welcome back once again. In today's show, we have a very interesting topic. That is nausea or morning sickness. Have you ever had that? Have you ever felt it? And if you felt it, how did you manage it? I know many mothers who feel like giving up, but you have to carry on. You shouldn't give up, because that is the process of the whole experience as a mother. So today's segment, we're going to talk about it, and we shall host a midwife who will tell us what to do, how to do, and when to do it. I'm Teacher Zita. Welcome to the show. We're at Emperor Heights Gardens, Entebbe Road. Let's get started and hear all the stories untold. Hello, welcome back to the show once again. I hope you had a very good day. This is a journey to motherhood, and in today's topic we're going to look at nausea or morning sickness. How was your experience? As for me, very bad. Really, really bad. And we are going to share various experiences and talks today with some mothers, and they will tell us what they've always gone through. Today on the show, we have a midwife, an expert. She will take us through the journey. She will take us through different things that mothers can do to help them combat that bad, weird feeling when they're experiencing nausea. It's a journey, and it's not very easy to handle as a mother when you're expecting, but what to do? You find yourself there. Welcome to a journey to motherhood. My name is Teacher Zita. Once again, in today's show, it's morning sickness or nausea as our topic, and we have a guest who is going to take us through the whole session. Welcome to the show, Florence.
Thank you.
Please say hello to the viewers. Tell us about yourself, what you do.
I'm Florence. I'm a midwife, and I work with the Entebbe Skin Clinic.
Okay.
So what I can tell you briefly about nausea or morning sickness. Actually, morning sickness is not only nausea. It is the feeling that a mother goes through, a pregnant mother goes through for the first 3 to 4 months of pregnancy. Sometimes these feelings, you may ask what the cause is, but the cause is really not yet well known, but it is believed it is because of the hormonal imbalances. Because your body...
Hormonal imbalances in women?
In women. Okay. Because men do not experience morning sickness.
Florence, why is it that some mothers don't have any nausea, they don't feel any morning sickness? Yes. They're okay from the word go, and others, it's very bad.
Yes, all of us respond to certain situations differently. Okay. Others have a calm pregnancy, others, theirs is terrible. Okay. And others, they don't experience anything, like they have not conceived. Okay. So this normally, it is for those that pregnancy disturbs them in the early
the first trimester.
Yes.
So what can you use? What can you do if you have that? But because sometimes you need to work, you need to travel, and you're busy spitting, you know, you want to throw up, you feel you're sick, you don't even know what you're suffering from, but you just feel so bad. What can you use? Are there some support treatments?
Okay, there are some support treatment given, but in the home remedy, okay, that is what we can advise them to do. When you have morning sickness, yes, depending how severe it is, there are some people theirs is too severe and need admission. There are others that it can be managed home.
So how do you do it when you're home? What can you use?
When you're home, when you feel, because this happens not only in the morning hours, as it says,
morning sickness.
No, at any time of the day. There are some who get theirs in the morning. There are some who get theirs in the evening or in the afternoon. They are there. So what we normally ask them to do, we ask you, take a lot of fluids, that drink a lot of water, because pregnancies differ. It is not only for the first time pregnancies, but every pregnancy has its own challenge.
True.
So it's not the same. What I experienced for this first pregnancy, for the second pregnancy
might be different.
Yes.
Okay.
So we handle it differently. So when we tell you take a lot of fluids because you're spitting, fluid is getting out of you. We tell you, go to bed a little early.
Okay.
Yes, take something sweet because energy is going.
Good. Sure.
Eat dry foods.
Dry foods like which ones?
Dry foods, we mean cassava boiled.
Boiled.
We actually don't tell you to eat spicy foods. We tell you that first put aside spicy foods.
Okay.
Mostly fatty food also put aside. Eat boiled.
Boiled.
Yes. But there are sometimes pregnancies may not allow you.
To eat anything, not even take water.
That goes to severe.
So in that case, what do you do?
That one we tell you go to the hospital.
Are there some tablets that mothers can use, swallow, or health workers can recommend to stop that?
There are tablets they can take, but however, I will not recommend a tablet now. It is for the hospital. Because in home remedy, I'm not going to recommend you on tablets.
Okay.
I will only recommend you on your foods. Eat dry foods, sleep a little
Things
early.
like cassava.
Wake up early in the morning. When you wake up early in the morning, take sweet tea, go and rest.
You go back to bed.
Yes, go and rest.
How is cold water? I was talking to some lady sometimes back, and I was asking her she was like, you can use cold water very early for bath in the morning. But remember, that's the time you don't feel like bathing, you don't feel like touching anything. And she was like, it is magical. How is it?
No, depends on somebody. All this depends on one person.
Okay.
Yes, it is an individual thing. I may find cold water very good for me, but for you, no. I may find warm water fantastic for me, but for you, no. So it depends on an individual. So mostly in the home remedy, we ask you the way you need to behave, and because if the spitting is too much, have chewing gum. You can be chewing the gum
to stop
the
saliva.
Yes.
Okay.
That one will minimize it. And then we ask you that, if you have GNATs, please chew.
Keep chewing.
1, 2, put in your mouth. 1, 2, put in your mouth. Okay. Yes, that helps you also calm down some situations. Yes.
Thank you so much. We are talking about morning sickness or nausea. It's a journey to pregnancy. I'm sure there are many mothers who could be watching and they've ever gone through the same thing, or you might be experiencing it. Please don't lose hope. Don't lose it. You can still be helped. You can take in dry foods, try waking up very early, try moving around, and boost yourself by eating things that you feel like you really love. We shall go for a short break, and then when we return, we shall look at more ways of preventing or working out nausea, just in case you're expecting. Thank you.